Well, health officials across the U.S. are working to stop the spread of the coronavirus outbreak. Right now, according to the CDC, there are at least 164 cases in the U.S. across 19 states, including 2 confirmed cases here in North Carolina. The goal is to keep that number low. We're committed to separating facts from fear when it comes to the coronavirus. And this morning, Dr. Cynthia Snider, an infection disease specialist from the Cone Health Regional Center for Infectious Disease, is here to answer our question. So first, let's start with the latest on the coronavirus. What kinds of cases are we seeing?
So predominantly in the U.S., we are seeing a lot of folks who have traveled from endemic areas and now back to their homes and are probably being placed on what's considered a self-quarantine to stay at home and watch for symptoms. So unfortunately, a lot of popular places for travel have been hit pretty hard. You're thinking a lot of places in Europe. We're seeing Italy, Spain, even France and Germany being involved. Obviously, this came out of Asia, so folks in China, as well as Japan and South Korea, as well as hitting the Middle East, which is Iran. So at least in the U.S., we're seeing quite a bit of folks who've been coming from areas that have been affected by COVID-19, as well as potentially it's spread among their close contacts.
Yeah, so now let's get everyone at home involved in our conversation. So how is the coronavirus impacting you? Is it changing your travel plans? Are you working from home, buying cleaning supplies and hand sanitizer, or it's not impacting you? Go ahead and go to WFMY.com/vote now to weigh in. We'll look at those results in just a second. But back to our conversation, Dr. Snider, what are the coronavirus symptoms and how do they differ from the flu? I think that's a big question for everybody right now.
Yeah, and I think that's a fantastic question. I think that's challenging is both the flu and the virus that causes COVID-19. They're both respiratory types of infections, and they're both caused by viruses. Generally with flu, folks probably show their symptoms very quickly. And so we're thinking about the incubation for flu to be just 4 days, but people start having symptoms at 2 days usually. When it comes to SARS-CoV-2, the virus that causes COVID-19, we noticed that the incubation period is up to 14 days.
Oh, wow.
And some people show symptoms as early as the 2nd day, but probably around the 5th or 6th day. The symptoms are kind of similar. So that's the hard part, right? We know that people get fever, they get cough and shortness of breath. Sometimes with flu also you have like body aches. The thought process is with COVID-19 diseases probably lasts a bit longer. It affects people who are much older, seem to have the most severe disease, as we're seeing with the outbreak that's happening in the skilled nursing facility out of Washington, which also happens with flu. So it is a little bit more, it's a little bit challenging at the get-go, but often enough we find out that someone else in their household has had flu. And we know, and the test is pretty accessible and rapid to find out.
Yeah, I was really wondering, when you get the flu, you just feel awful. And so I was curious if we feel the same, or you would feel the same way if you had the coronavirus.
So that's a good question. I think there's a description of people having very mild disease. About 80% of people have very very mild disease of even feels like they have a cold. However, we really focus on the folks that are having pretty big symptoms such as fever and shortness of breath. They're having signs of pneumonia and a lower respiratory infection, so you would feel kind of more poorly. And that's also the time when the thought that you're probably a little bit more contagious.
Okay, and so if someone thinks that they have these symptoms and they think they may have the coronavirus, what do they do?
So there are plenty of resources in the community. I know that the State Department has created like a helpline for questions from the community about coronavirus. I believe a lot of institutions, like different healthcare communities, have had postings on their hospital websites, and also they've disseminated a lot of information to their primary care doctors to help ask those questions. If somebody has traveled from a community that has had coronavirus in terms of multiple cases, I think that is a good thing to bring up to their primary care doctor. And so if you're having fever and shortness of breath or cough, it's worth calling to letting them know ahead of time that you would like to be assessed. And then also you probably can talk to the person on call for that clinic to finding out should you be going to the health department should be going to the clinic versus the emergency room.
Okay, and of course we have that number for you on our website. But quickly, our last question is, how are hospitals across the U.S. and in the Triad prepared for the coronavirus?
So I think a lot of institutions are working very hard, including Cone Health, and getting prepared for the estimated cases in the community. So we're trying to increase not only provider education, but patient education. I think common sense needs to prevail, right? Hand washing, as we were mentioning before, is so important. Cough hygiene as well. If you're sick, try to stay at home. Also, probably avoid traveling to areas that are affected by coronavirus.
All great information. Thank you so much, Dr. Snider, for joining us this morning.
You're welcome.
And of course, we have more information about the coronavirus on our website, WFMYnews2.com.